March is Endometriosis Awareness Month, highlighting the chronic condition that affects millions of women nationwide. And joining us now is Dr. Devin Garza. He is a gynecological surgeon at St. David's Women's Center of Texas. And Dr. Garza, thank you so much for being with us.
Thank you, Quita. Thanks for having me.
Now, this is such an important topic. We really want to talk about first what endometriosis actually is.
Endometriosis is a disorder that women get where the tissue that's on the inside of the uterus, that lining, tissue very similar to that, but becomes very abnormal and implants internally on pelvic structures and the structures on the inside of the abdominal cavity.
Well, what are the most common symptoms of endometriosis?
Because of that aberrant location of where it's implanted, inflammation is what causes the majority of the symptoms, and those symptoms are on a spectrum, but they can be terribly painful cycles, abnormal bleeding, pelvic pain, pain during sexual relations, and other types of problems with their GI system.
Now, this actually sounds quite debilitating. This can really have a huge impact on a woman's daily life.
Quita, the condition is not life-threatening, but it steals the quality of a woman's life very, very often.
Now, how many women actually suffer from endometriosis, and why can it be so difficult to diagnose having it?
Published data says approximately 1 in 10 women have it, but these are old studies with older type of technology, and I would challenge that to be many more than that. However, once a woman gets symptoms, some of the ones I mentioned, especially a chronic pelvic pain or debilitating pain with their cycles, their risk goes up significantly. Patients who have no symptoms can have infertility, and of patients who can't get pregnant, 40% are due to silent endometriosis.
Now, you talked about the studies being old. Why don't we have new studies for what's happening to so many women across the U.S.?
I wish I had the perfect answer for that. I spend most of my time just using what we do have to make women have a better quality of life.
Good deal. And how can it actually be treated or managed?
Endometriosis has significant symptoms on a spectrum. It can be managed medically to make the symptoms better, but to get the disease out of the body, we call that surgical excision of the diseased tissue, is a more complex process, but it is probably the most likely way a woman's going to have the longest term benefits from the disease itself.
So it can be cured?
There's no specific cure, but there's a temporizing or a way to make it better for most women for a longer period of time.
Well, how do women who think they may be suffering from endometriosis advocate for themselves with their families, with their doctors?
Absolutely. As an advocate for women's health, especially regarding this syndrome of endometriosis and the spectrum of which these type of symptoms can present themselves, a woman just needs to tell the doctor what her symptoms are and don't accept that you're normal unless we have an absolute surgical evaluation that says you are. And even then, don't accept no for an answer. Get another opinion if necessary. Make yourself be heard.
Excellent advice. Dr. David Garza with St. David's Women's Center of Texas. So much good information. Thank you so much for joining us.
Thanks for having me on, Quita.